Hello, this is Chad Curry, the Training Chief at UMCMS. Today we'd like to discuss the Acute Mental Health Care Crisis Protocol. This is a new interactive PowerPoint that is talking about the new protocol that will be coming out April 1st of 2015. The intent of this protocol is to allow EMS to bypass the hospital emergency rooms and directly transport the patient to Sunrise Canyon. This allows our patients who are in a mental health crisis to receive care from the mental health specialist immediately instead of going to the emergency room and being cleared first. Here's an initial look at the protocol. This protocol does follow under our other protocols that have come out. This will be interactive in the protocol book, just as all the other protocols are. So as we start to look at this protocol a little bit further, we start talking about the history of the patient. This may be an acute or something brand new of a psychiatric illness, or it may be something they have a chronic history of. These patients a lot of times will be suicidal or homicidal with or without an action plan, and situational crisis may be causing the acute psychosis that's occurring today. The signs and symptoms, things we're going to be looking at is agitation, confusion, anxiety. They may be hallucinating, delusional thoughts and bizarre behavior, along with an expression of suicide and homicidal thoughts, along with depression. Some of the differential diagnosis we've always got to rule out is that alcohol intoxication, which may be causing the altered mental status, or toxins and substance abuse in the body that also may be causing the altered mental status. Sometimes this can also be caused by medication withdrawal, bipolar, and schizophrenia. So as we break this protocol down even further, we'd first of all like to talk about our scene safety. Very important that we get a hold of LPD and we make sure that our scene is safe prior to any transport, and to assure the safety of all first responders on scene. Our first qualifier we have is an age qualifier. Sunrise Canyon is taking patients that are 5 years of age and older for psychiatric eval. If the patient falls below the 5 years of age minimum, then you will just transport them to a local emergency department as we normally would. The next qualifier we have is vital sign ranges. We have a heart rate between 60 and 110 beats per minute. A systolic blood pressure needs to be between 110 and 160. Pulse oximetry needs to be above 92% on room air. Blood glucose level needs to be above 70, but not to exceed 300 milligrams per deciliter. And the patient needs to be afebrile, which falls between 96.8 and 100.4 degrees Fahrenheit. The patient needs to be next is compliant, and they need to make sure that they're cooperative, they're voluntary, and they're nonviolent toward EMS. The next one is able. We need to make sure that they are awake and alert and they can ambulate on their own. And as we talk about that a little bit more, we talk about clinical intoxication. This will send you over to your first yellow box, which is 1 asterisk, and it says that the patient may consume alcohol or drugs, but is not clinically intoxicated, meaning that he or she can walk normally without help and can appropriately make decisions and talk normally. Medical conditions. We want to make sure that this psychosis that's occurring at this time is not caused by an underlying medical condition. Examples of this would be hypoxia, blood glucose level, hypertensive emergencies, and or head injuries. Then we move to injuries. We'd like to make sure that the patient does not have any acute injuries or that was performed today in the type of a suicide attempt. Also, ingestions may come into play here. We need to make sure that the patient has not taken anything and doesn't have any active injuries or wounds that need to be addressed at the hospital. For our female patients, we want to make sure that they deny pregnancy. And last but not least on the qualifiers is the overdose. We want to make sure the patient denies overdosing on any prescription and non-prescription medications. As you can see, that has a double asterisk there, and it'll take us over to our next yellow box that says if there are any patients, there's any chance that the patient has taken too much medication, we transport them to the emergency department. We also want to make sure that we're asking about Tylenol and aspirin. As we all know, that's a common thing for people to take too much of in order to have a suicide attempt, so that non-prescription medication comes into play. All of these qualifiers need to be met. We need to be able to answer yes on all of these qualifiers in order to get to a direct transport to Sunrise Canyon. So at the end of the day, if in doubt, we always want to make sure to err on the side of the patient and transport them to the emergency department instead of to Sunrise Canyon. And last but not least, how do we get there? First of all, we'll ask the patient, do they know the hospital would they like to go to? If they say Covenant Medical Center or the Plaza, we'll need to transport those patients to Covenant Medical Center emergency room. If they say University Medical Center or Sunrise Canyon, we can notify Sunrise Canyon by calling the caseworker that's on call. That phone number is 6-790-1127, and they are there 24 hours a day, 7 days a week available. And that's when we'll be able to transport that patient direct to their facility without any further delay. So as you arrive at Sunrise Canyon, there's only one driveway coming in. The very first left comes into where we take our normal transfers for University Medical Center that we are leaving on for discharge to Sunrise Canyon. That will remain the same on the very far east door, and the same procedures fall into place as we currently do. Next, we have a daytime door. This door is in the middle of the complex. It does have a green awning on it, and the door actually says law enforcement on it, and this will be in the middle section of the complex. Next is our nighttime door. This is where we use the circle drive, and this will be the nighttime, and there's the circle drive, and it does have a silver color awning over it, and it does say the main lobby on it. Here's a couple of more views. This is a view from the west side of the circle drive. This is once again the nighttime, and it does read main lobby on it. We want to make sure that we're taking our nighttime patients. Nighttime falls anytime after 5 p.m. This is a look from the middle section or from the law enforcement door, or this is our daytime door that we'll be using, and then looking back to the west toward the nighttime door. If you have any questions or comments, please make sure to notify any of the training staff. We'll be glad to help you by phone or by email. If you have any corrections or you run into any problems, please feel free to call us at any time. Once again, this policy and procedure will be going into a place on April 1st of this year, and we'll be notifying everybody by email and putting out the protocol in the protocol book. Y'all have a great day. Everybody be safe out there. Thank you.